So the Champion Plan adopts many of the principles of what Gloucester has done with police-assisted recovery. So it initiates, anyone can walk into the Brockton Police Station, walk right up to the desk and just indicate that they're seeking assistance for drug or alcohol addiction or treatment. And immediately a phone call is made by the police over here to Stairway to Recovery. Stairway to Recovery is a peer support group, folks with recovery who are helping other people in recovery. And it was a natural marriage when we looked at what, this was something we did a little differently than Gloucester. Gloucester uses volunteers called angels. We already had folks right here in the downtown that were already providing this type of support for people. So they agreed, and I'll let you know that almost everyone here is a volunteer. So what these folks do is a couple volunteers will go right over to the police station, greet the person, bring them back here, help support them during the time period while looking for treatment. And then we've got 5 or 6 treatment partners that have agreed to do their best to get us a bed whenever we need one. And so the folks here, the volunteers here are trained in telephone intake, providing assistance, helping the person. Another one of our key partners is Brewster Ambulance, who's our city's ambulance service. They are providing free transportation from here to whatever treatment facility we can find a bed at. So that could be right down the street at High Point here in Brockton, but it could be Westboro, Spectrum, it could be Gosnell down the Cape. But the idea is that someone can actually come to the police seeking assistance and then get this type of support and get into a treatment bed. And Corin, you're gonna have to help me with the numbers. Is it 40 that we're up to now?
41 as of
So
today.
tell us a little
41.
bit, can you tell us a little bit about the program on a day-to-day basis here?
Sure, I think Stairway, Ephraim
Yeah,
can
yeah,
help me a
Frank,
little
good.
bit, but
Okay.
Stairway to
on up
Recovery
here,
does a
Frank.
great
Come on,
job.
come on
We
up
have
here, yeah.
some of our individuals here as well that do a great job, and
Great.
It's
Work
so
very
much to
hard.
talk about it. What you need to know?
Well,
How many people-
what's your name?
Ephraim Baez. I am the program director. We opened the doors in Stairway to Recovery in May 2008. We have served around 1,700 members, has gone through the doors of Stairway to Recovery. When the mayor approached me with this idea, I said, wow, we've been doing something like it, but not as the Gloucester program. So it was a mutual agreement with the peers, because the peer had to say a lot what's going on in the center, because we use the participatory process. This is a community in recovery who decide what's gonna happen here at the center. So when we brought the idea to the community and say, we was approached by the Mayor Carpenter to bring a copy of the Gloucester program over here. But we're gonna be better because we got a Stairway to Recovery, we already doing that. So they agree, and we launched the program February 29, and since then we have placed 41 members.
Already.
Already.
And in 2 months, they've successfully placed 41 people into treatment. They're batting 100%. Every single person who's come in seeking assistance has been placed in treatment. One of the things, we're doing a few things differently than Gloucester. One is a specific outreach to veterans as part of our overall strategy to end veterans homelessness. But also, under Corin's guidance, we're also doing follow-up. We're not just sending people off to a detox so that they leave in 4 days and relapse and keep going around and around and around. So we're actually following up with people and encouraging them to continue on to treatment, supporting them, I guess would be a better phrase, in continuing to seek longer-term treatment that we know is the best path to recovery. And do you have even a guess, Corin, like what percentage of people that we've helped have actually agreed to more treatment than just a detox?
well, we probably made contact with actual personal contact with 85% of the
Yeah.
41. So,
Yeah, and
which
almost
is
all agreed to
tremendous.
stay in treatment.
Bill,
Gotcha.
I'm sorry, but I
That's
had to
okay.
bring Peggy over here.
Peggy.
because
Yeah.
Peggy,
Peggy,
she
come on, Peggy.
has been the key
Yeah.
player in the championship.
Come on, Peggy.
Come on,
yeah,
Peggy.
come on, Peggy.
She don't like too much attention, but we need to thank Peggy because
So Peggy, turn
whatever
around.
she
Tell us a story,
doesn't
Peggy.
find,
Come on.
Thank you, good to see you, Peggy.
she
Tell us a story,
dig,
Peggy.
she dig under the ground to find place for the champion. She's the one who has every resources in Massachusetts. She's whatever she can find, I don't think nobody else can find.
Beautiful. Peggy?
So we were excited when the mayor approached afraid all of the peers to help. It's a chance to get people to go into longer term. Most people go and they'll do 4 or 5 days in detox and then feel better and leave. The mayor and Corin's plan was that we would follow up people after 72 hours, 1 week. And we have over 3/4 of the people that have come through are still in long-term treatment right now. And those that
Which
are
is an
not,
amazing percentage, an
Absolutely.
amazing percentage. One of the challenges we've been facing is this constant merry-go-round. You hear stories of people with dozens of detox. And so one of the things, and this is really one of the key elements of the program, and this is what Stairway to Recovery brought to us, was peer support, people in recovery supporting people in recovery. And really, they deserve a lot of the credit with Corin, but to think that 3/4 of the people that have walked into a police station asking for help are still in treatment and continuing into long-term treatment, it's very early, but the results so far, I think, have exceeded our wildest hopes.
Now, can one of the peers talk to us?
We have 2 peers in the
Okay,
back.
come on. See, we want to hear from you.
Yeah.
There we go.
There you go.
They got
Come
the
on up.
sweatshirt.
Come on up.
Yeah.
Come on up. Talk
This
about,
is the
Got it.
teacher for champion.
talk about what you do.
What we do here at Stairway Recovery, we provide like a safe haven for those in recovery, like those who are really committed and dedicated to their recovery. And what we would do is we provide every resource that we have available, and we let them know like the pathways to recovery they can choose, which we're not like, we do not discriminate whether it's NA or AA or spiritual or meditation or whatever it may be. We try to do what we can to assist those in recovery. So
So one of
That's
the
a very
keys,
good
I
thing.
think, Senator, was that these folks were already here doing this work, and this is one of the things we've been able to do is to parlay some of the state funding. So there's some DPH funding that helps to support this program, but now look at the tremendous return we're getting on the investment here with this incredible work that's being done by the volunteers. And I should mention to folks, so within about, maybe it was 2 weeks after I became mayor, I had my first chance to meet the senator as mayor, when you brought the drug czar of the United States down to Taunton as part of your initiative in addressing the overdose crisis. And we had a great conversation that day, and we've had many, many conversations since. And so when I was in DC recently and told the senator about what we were doing with the Champion Plan, he told me the next time he was home, he was gonna come down and see what it was all about. And I didn't really think he would do it, but he called and came down to see it. So Senator, we really appreciate your leadership on this issue and your commitment and the fact that you were willing to come down here today and take a look at it with your own eyes, and we appreciate it.
And we thank you.
Well, the mayor was in my office in Washington 2 weeks ago, so is this fast enough? He told me how great the program was and how, much of a model it could be for the whole country. So you, tell us a little bit about the program. What's your name?
Mary Lou.
Mary Lou,
Yeah.
tell us about it.
I just want to say that we provide hope and that recovery is real, pretty much. Basically, and everything that Wayne said, he's pretty much back to everything that is.
So, and how many years have you been doing this?
Well, I've been with Stairway for about 1.5 years, so I've been doing this pretty much for a long time because I've been in dual diagnosis, so I've been doing both.
I see. And how about you, sir? How long have you been doing it?
I've been doing this for about 1.5 years here at Stairway.
Yeah, beautiful.
So these is a matter of putting these elements together. So we have these very committed folks here at Stairway who really are providing the connection. And Corin and I have been able to establish relationships with all of the major treatment centers in the area that are working as hard as they can to work with us in getting a bed when we need a spot for somebody. And that piece has worked out really well. But another big piece of this is changing the perception of the public of the police department and the role of the police in this fight against opiates. And it's also police officers' attitudes and approaches changing towards how we're going to best address this crisis also. And when you and I were talking about this a little over 2 years ago, we were just deploying Narcan on all our first responders. We were the first city that had police, fire, and EMS all carrying Narcan. And so now, 2 years later, you've got police officers, many who have saved multiple lives administering Narcan. And so now it's not just about arresting people. We have police officers who are carrying Narcan and saving lives, and now changing the viewpoint of the police station as being a place that you can seek assistance. So there's a lot of benefits to this at a lot of different levels. But the main thing is that 41 people are in treatment today that would not have been
And the
2
program only
months ago.
started
Just about 60 days ago?
60 days.
February
60
29th.
days.
Yeah.
February 29th,
And
so,
those are 41 lives that could be in jeopardy but for the program that you're now actually increasing in terms of the accessibility.
and 3/4 of whom are remaining into longer-term
Yeah.
treatment, which is one of the big challenges, so,
So it's incredible,
yeah.
incredible. So, so as the mayor said back a little bit more than 2 years ago, I had my first summit in Taunton.
Right.
And on that day in Taunton, when I brought the drug czar of the United States to Taunton, while we were in the fire station, the alarm went off, overdose on Main Street, and the engines had to leave the fire station even as we're having the summit. And that was kind of the kickoff to me of the efforts that I was going to make to try to change the way people view this issue. And even then, you were telling me, the mayor of Taunton was telling me, that fentanyl was beginning to show up in some of these deaths. And that the treatment beds weren't there, that the programs weren't in place. And so this is the beginning of a revolution. And it's happening here in Brockton, where we no longer say, how are we going to incarcerate our way out of the problem? It's how can we treat our way out of the problem. And you've got the police department not incarcerating, but treating these patients. And it's
I should make clear though, Senator, we are still arresting drug dealers.
No,
we're
and I
trying to
appreciate
arrest
that. I
as many of
appreciate
those as we can. We've doubled our number of search and entry warrants, so for people that are trafficking in large
I
amounts of
appreciate that.
narcotics, we are putting them in jail, but you're right, but we're trying to approach this from both supply and demand.
Right.
And we know we can save lives by getting people into treatment.
Well, what
And,
the drug dealers are trying to do is to get people onto heroin. It's to get people onto heroin laced with fentanyl. Then they have a customer. And these customers, from their perspective, are disposable. But what you would call them are the family members of Brockton. And those are the real people who your program is meant to deal with. So you have to arrest the bad guys, but you have to treat the victims, and most of them are victims. Most of these people are just innocent people who have been caught in a terrible system, and if we give them the treatment they need, we can make a difference in their lives. And so that's what Brockton is. Brockton has a champions program here. It's a stairway to recovery, which you're the leaders, you're the revolutionaries that are making it possible for us now to think there's another pathway for these individuals, for their families, that can change their destiny, and it doesn't have to result in tragedy. It can result in triumph for those individuals. And we very much appreciate, Mr. Mayor, your leadership and all of the people who are here who are creating this new model.
So Senator, just to put into context for you what the impact has been here in Brockton, we saw on the news they released the number yesterday, 1,400 and something overdose deaths in the state last year. Here in the city of
Because that's what's killing people right now. And fentanyl is 50 times more dangerous than heroin. It's almost a recipe for death. And so we have to make sure that the federal government is giving the help to the state to be able to deal with this issue, because that is unfortunately what is going to be unfolding over the next years as the real danger to people on the streets. 1,400 people died last year in Massachusetts from opioid overdoses, half of them fentanyl related. And if we don't get on that issue fast, if we don't deal with the Chinese, with the Mexicans and others, it's going to explode.